Hello, my name is Molly, and today I will be demonstrating the use of the ODU 1112 Explorer. So the main purpose of this instrument is to detect both supragingival and subgingival calculus. So I will be using a relaxed modified pen grasp and fulcruming on my ring finger to explore the entire mouth. So next I will get into starting with sextant 1. Okay, so here I'm starting with the buccal of the upper right quadrant and the posterior teeth. So first I'll make sure that my explorer is the correct working end. So I have the V pointed towards the distal of the tooth, and I started on the distal surface, the distal buccal surface of the tooth. And then after that, I reinserted at the distal buccal line angle and did the straight facial. And then once I get to the mesial buccal line angle, I want to roll into the interproximal area and reach interproximally to feel any calculus, both supragingivally and subgingivally. So I also did the same thing on the next molar. And as I move into the premolar, same principle there. So after I did the distal, moving on to the straight buccal, rolling at the mesial buccal line angle, and I'm using a opposite arch fulcrum, and I want to keep the terminal shank parallel to the long axis of the tooth as well. Okay, so next, as I'm moving to the anterior teeth, I now have the correct working end when the V of the terminal shank is pointed towards the midline of the tooth. So first I'm starting with surfaces toward me on the buccal. So I'm sitting at like a 9 o'clock position, fulcruming 1 to 2 teeth in front of the tooth that I'm working on. So same thing, here I want to keep the terminal shank parallel to the long axis of the tooth, but I'll start on the midline of the straight facial and then work my way towards the surface toward me, either the distal or the mesial side of the tooth, and then rotate at the line angle to work interproximally to feel for any calculus. Okay, so next I'm doing the surfaces away from me on the facial of the anterior maxillary teeth. So I've turned my working end so that the terminal shank gets the V is pointing towards the midline of the tooth. And I'm also going to start on the straight facial, the midline of the tooth, and work my way around the surface away from me. So I'm fulcruming again 1 to 2 teeth away, and I want to roll smoothly into the interproximal area once I reach that line angle, while also keeping the tip 1/3 adapted. Okay, so now I'm moving on to the buccal surfaces on the posterior left maxillary quadrant. So I'm starting on the distal of number 16, and I want to have a nice light grasp to increase my tactile sensitivity, and I'm going to roll once I get to the interproximal. So now I'm kind of on the straight, and I want to roll interproximally while keeping the terminal shank parallel to the long axis of the tooth. And if I were to feel any calculus while I'm doing my calc map, I would document that on whether it's subgingival or supragingival. So that is something that I'm feeling for, and I want to make sure that I have a nice fulcrum. So I'm fulcruming on the opposite arch to reach the posterior teeth. Since it's a nice light stroke too, I found that to be a little bit easier to access those teeth, and I'm using the mirror to retract the gums if I were to have a real patient there, and I'll also kind of look in the mirror a little bit too to kind of see where my explorer is going, as well as I'm mainly relying on feel as well. Okay, so now I'm moving to the lingual surfaces, starting on the maxillary left quadrant. So I'll start on the lingual distal, or the distal lingual of number 16. And same thing as I've been doing, I want to keep my tip 1/3 of the instrument adapted, rotate at the line angle, and feel for both sub and supragingival calculus. And I want to keep my instrument terminal shank parallel to the long axis of the tooth. And for these molars here, I'm fulcruming on the mandibular arch on my ring finger. So as I'm working my way forward, I want to keep my tip 1/3 adapted, as I've said before. And here I might have the patient turn away from me just a little bit so that I can see those surfaces toward me a bit more clearly. Okay, so next I'm going to do the lingual surfaces on the anterior. So I'm starting on surfaces away from me and getting the distal of the canine from the lingual. So I'll start on the midline of the tooth and rock on my fulcrum and roll into the interproximal. And I have the V of the shank pointed towards the midline of the tooth. I'm using my mirror for indirect vision, so I can stay adapted with that tip 1/3 of the instrument, and record any calculus that I feel. And I'm going to use a nice light exploratory stroke, so rolling there interproximally all the way up to the contact. And now I'm going to do the other side of the tooth, so the surface is toward me on the interiors, on the lingual aspect of the maxillary teeth. So I've changed the orientation of my instrument, or I've changed to the other side working end so that the V is pointed towards the midline of the tooth. And same thing, I'm going to start on the midline and roll at the contact. And I'm also, while I'm doing this, I want to stay subgingivally. So if it was like a real patient, I would see blanching of the tissue to know that I'm going deep enough, and staying adapted to will also be very important. Next, I'm going to explore the lingual surfaces on the maxillary right quadrant. So I'll start on the distal of number 1, and I have the instrument, the V, pointed towards the distal of the tooth. So I do the distal side and then reinsert at the line angle to work my way mesally, and rolling interproximally. I want to stay adapted with my tip 1/3. And for this sextant, or this quadrant, I'm sitting kind of at like a 10 o'clock, 9 o'clock, using my mirror to see this surface, since it's kind of like the surface away from me. And now I'm moving to the premolars. So same technique as I've been doing for the other posterior teeth. Maybe I could have rolled a little bit more into there, especially since these teeth have a little bit more of a concavity there on the anatomy, so I want to make sure I feel any calculus there. Alright, so now I'm moving to the mandibular teeth, so I'm doing the buccal surfaces on the lower left, and I started on the distal of number 17 and I reinserted at the distal buccal line angle, and worked my way mesially. Watching back on this video, I think I could have uprighted my instrument a little bit more as I'm working mesially. That's something I think I can improve on. Also, same thing on these premolars. I want to keep my terminal shank parallel to the long axis of the tooth, so I think I could keep my instrument a little bit more uprighted in order to achieve that. But I have my fulcrum there kind of on the facial on a couple of teeth in front of the one I'm working on. So I want to have a nice steady fulcrum but a light grip of the instrument. So rolling there interproximally. Okay, so now I'm moving on to the interior teeth on the buccal of the mandibular arch. So I'm doing the surfaces away from me. So I have the V of the shank pointed towards the midline, and I start at the midline of the tooth and roll interproximally once I reach the line angle. And also looking at this video, I think I could also keep the shank more upright to be more parallel with the long axis of the tooth, especially as I work my way towards the right. I think canine, I'm a little bit off parallel there, so I also want to improve on that on these anterior teeth. Okay, now I'm doing the surfaces toward me on the buccal aspect of the mandibular teeth on the anterior. So starting at the midline, I'm gonna rock on my fulcrum and roll the instrument interproximally. And for these teeth, I'm sitting at like a 9 o'clock position, and I have good vision here. If I needed to, I'd use my mirror or my finger to retract the lower lip too. So I have good visibility in this sextant. Next, I'm gonna do the buccal surfaces on the posterior right. So starting on the distal of number 32, and I'm gonna reinsert the Explorer at the distal buccal line angle and work my way mesially. And same thing as I did with the posterior left, I kind of want to upright my instrument in order to keep it parallel to the long axis of the tooth. So using short exploratory strokes on my fulcrum, short oblique strokes as I work my way mesially will be important. And there, reinserting and rocking on my fulcrum, uprighting, turning interproximally, want to roll all the way, and kind of reach into that core area, and staying adapted with the 1/3 tip of the Explorer, and keeping my grip nice and light. And now I'm moving on to the lingual aspect of the posterior right, lower right quadrant. So I started on the distal of number 32, and now I'm working my way on the mesial side. So still fulcruming a couple teeth ahead, and want to keep my instrument parallel to the long axis. So want to kind of upright my instrument as I work my way mesially, and note any calculus that I'm feeling. I have the V of the instrument pointed towards the distal of the tooth, so I know I have the correct working end, and I want to keep my Explorer in the sulcus, so I can feel for any subgingival calculus, and rolling there at the line angle, trying to keep good adaptation with the 1/3 tip of the instrument, and there I'm just rolling at the line angle to get the mesial of the premolar, and rocking on my fulcrum and using the mirror for indirect vision. Okay, now I'm doing the lingual of the anterior mandibular teeth, so I'm starting on surfaces toward me. Looks like I started on tooth number 22, so using indirect vision to see into the mirror. Start on the midline of the tooth, and then working my way, rolling at the line angle to continue exploring the surface toward me. So I want to keep my instrument nice and upright, and now as I work on the surfaces away from me, same principle. I want to keep my instrument parallel to the long axis of the tooth, so or the shank, terminal shank, so I want to keep my instrument nice and upright as I turn interproximally at the line angle. And I'm also using indirect vision, sitting at like a 12 o'clock position. Now I'm moving to the lingual aspect of the lower left quadrant. So I start on the distal of number 17, and I have the view of the instrument pointed towards the distal of the tooth, fulcruming a couple teeth ahead, and working my way toward the mesial side of the tooth. I might use the mirror to attract the tongue as I work on these teeth, but same thing, I want to keep my tip 1/3 adapted as I roll interproximally, keeping the terminal shank parallel with the long axis of the tooth. So that is kind of a main focus of mine as I've been exploring the mouth. And there, roll, staying under the sulcus as I'm working with short exploratory strokes. And there we go. Alright, so thank you for watching this video. That was me exploring the mouth using the 1112 Explorer. So my main focus was keeping the tip 1/3 of the instrument adapted and rolling out those line angles. So that is something I will continue to work on. And next week I will be doing the sickle scaler. So thank you again for watching, and have a good one.